Philip Dunne.
Thank you, Mr Deputy Speaker, and I'm pleased to support this bill, the first significant reorganisation of the healthcare in recent years, only the second since the Conservatives came into office following 13 years of Labour administrations when they reorganised the health service 9 times. So we shouldn't be taking lessons from members of the opposition on the timing or the fact of putting things right. This is a very substantial piece of legislation, and it's learning from some of the lessons that we've taken away from the way in which the NHS has had to work during this COVID pandemic, and in particular, looking at the acute sector, the way in which the flow through of patients have been discharged out of the acute sector as a result of much closer working with social care and local authorities is an integral part at the heart of creating the new integrated care boards. And I very much welcome the fact that these are now being established on a statutory footing, and that there will be representation from local authorities. There will be a role for the health and well-being boards to provide local oversight. I think this is an essential step in order to allow the healthcare economy across our communities to collaborate effectively together and to remove some of the artificial barriers. I'd like to touch on 3 other things very briefly. Reconfiguration and the measures proposed for that. We in Shropshire have been at the wrong end of a very protracted process for reconfiguration of our acute hospitals. Streamlining the process by which decisions are made will benefit patients. The experience in Shropshire has been that it's taken several years to reach a point where decisions can be made, and there are at every stage obstacles put in place which just add to delay and uncertainty. And as a consequence of this delay and uncertainty, it's hard to attract staff to work in a system which is not working as well as it should be, and the system itself has gone into special measures. So I think that these measures to streamline these difficult decisions are very welcome. Secondly, on workforce, as the Chairman of the Select Committee said, the bill is somewhat light on workforce, but it does include some key measures to speed up the ability for those who are trained physicians in other systems to be able to be welcomed into the NHS or to return to the NHS if they have retired. And I would urge in committee stage the ministers to look very carefully at what can be done to